whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. All right. Thanks for joining us. Today we are talking to Tim Murphy. So Tim is a long-standing leader with more than 30 years experience in digital health space and just recently was awarded the title of Digital Health Executive of the Year 2023 by Digital Health Canada. For the last 6 years, Tim has been the Vice President of Health at Alberta Innovates. And so Alberta Innovates, of course, being a Crown Corp funded by the government of Alberta with the mandate to promote innovation within the province, and is probably the most well-known grant funding body in the region. So if anybody out there listening from Alberta has received grant funds for their healthcare-related projects, there's an excellent chance Tim and his team would have been involved in that. So Tim, thank you so much for joining us today.
Very good, Jordan. Thank you very much for having me. I appreciate the opportunity.
And so why healthcare? As a buffet of opportunities out there, what drew you to this space initially?
Well, unfortunately, Jordan, when I was 15 years old, my mother passed away of breast cancer at the Princess Margaret Hospital. And then when I was doing my Master's of Health Administration at UAT, we had a chance to do a practicum placement for that program. And you selected 3 hospitals. I was fortunate enough to be selected by the Princess Margaret Hospital to go back into that environment. And I think what ignited my passion for healthcare and health system transformation, for research, for innovation in that environment, was just the learning culture that the Princess Margaret Hospital represented. And it sort of drew you in, and you met a bunch of great mentors, leading edge researchers, leading edge thought leaders in oncology. And they inspired me for the 7 years that I was there to continue my career in health services and health research and innovation. So that was sort of the unfortunate part, the death of my mom, but then that led me to wanting to give back, wanting to do more, and wanting to help transform the health system for better.
And so that deep personal connection then, obviously that must have been very difficult going through that at a young age. Cancer care, of course, you always being on the cutting edge in terms of medical and developments and technology. I mean, did you yourself know you really wanted to be in that innovation space early on, or how did you get pulled into that side versus, say, healthcare delivery itself?
Yeah, so when I was there, I was what was called the corporate staff assistant, reporting to Dr. Don Carlo, who was the president and CEO at the time. I worked also with Janet Bede, Susan Connor, and Simon Sutcliffe, my mentor and friend. And so that was on the administrative side. Jordan, you're correct. And what drew me over to the research innovation side was just the research innovation culture of the Princess Margaret Hospital. But there was one signature project I took on, which was the review of the clinical research at the Princess Margaret Hospital. So I was teamed with Dr. Jim Till. I don't know if you know Dr. Jim Till, but he was Dr. Jim Till and Dr. Bum McCullough. Discovery led to the creation of stem cells. They had actually discovered stem cells, so they were involved in the clinical research review. And again, you wouldn't know Jim Till, but he had a passion, and he really drew you into his orbit, and that inspired in me a sense of the research innovation world. And I guess I've kept that even though I pursued administrative roles. And then when the opportunity came up in 2002 with the Michael Smith Foundation for Health Research, it was too good to resist. So I actually moved over and applied and was recruited to be the inaugural Senior Vice President of Corporate Services and Programs with the Michael Smith Foundation for Health Research. And that was about 20 years ago. And the rest, as they say, is history. I don't think I'll go back. I'll stay in the research and innovation space.
Healthcare innovation's gotten its claws into you, I guess. It's hard to escape now.
It gets under your skin. It gets into your. It's something that, in a good way. I don't think it's a bad thing. It's a good because you're working with red hot people in terms of ideas, mentors, and it draws you in. Very much like the Princess Margaret Hospital drew me in. It was very much a learning culture, and as I said before, Jordan, that culture greets you at the door. It's something you can't really describe or put your finger on, but you know it when you see it and you feel it. and then you get drawn into it. So it's a very exciting place to work, and I've kept that for the majority of my career.
No, that's awesome. And I mean, just like the magnitude of impact one can achieve over the course of their career when you're supporting the supporters, right? When you're working on those systems level problems, I imagine that just, is so far reaching.
Yeah, I mean, obviously, when you work in a cancer system, you're working for an organization, but the vision of the organization is a world free of cancer, right? So how do you achieve a world free of cancer? It's obviously outside the four walls of the institution, and you're always trying to go upstream and to help prevent cancer where you can. You're trying to change the mindsets around where you put resources, where you put your time. And I guess now with all the tools we have at our disposal, artificial intelligence, machine learning, the ability to predict, really data analytics, these things are really transforming healthcare. So in oncology, if you take a system perspective, again, that's something that stuck with me. And I mean, some of the stories were, basically if you can get upstream for a lot of the patients that arrive at a cancer facility, unfortunately, for some, it's too late, right? So you want to be able to go upstream in the process and intervene as quickly as you can to give people the highest probability of a downstream outcome success, right? So that should be the goal and vision of our healthcare system.
And then I know you've been involved quite a bit with the Movember Foundation as well. And for anybody who hasn't actually heard of them before, so this is like probably one of the funnest cancer fundraisers across the world now. I think they're an international organization where every November all the men do their best to try their attempt at growing a mustache. How did you actually get involved with them?
It was from my connections in the cancer world. So, I mean, first of all, Movember is a fantastic organization. They're trying to change the face of men's health. And at the time, I don't know what the stats are now, Jordan, but they were in about 21 countries and they raised about $140 million globally annually for their campaign. So it was a very large campaign when I was involved back in 2010, 2011. How I got involved was, though, there was a review of Prostate Cancer Canada. So Dr. Colleen Nelson from Australia was in the cancer world, a colleague of mine, and Dr. Howard Sewell, who ran the U.S. prostate cancer group. And I was the Canadian involved in that review. We reviewed Prostate Cancer Canada, wrote the report, handed it into the Movember board. They liked the report a lot. And so they asked me to, after we finished that piece of work, they said, could you stay on and work in Canada to help define a secondary cause beneficiary? So I did an exercise with the community, consulted broadly across the country, and we landed on men's and boys' mental health as one of the other focus areas of investment for the Movember Canada crew. And so that was a way of giving back in terms of that activity. I also got involved in the review of prostate cancer Australia. So they had me come and and then that particular exercise, I was the chair of the review committee. So that was very good work. And just a shout out to my friend and really a mentor, Paul Valente, who was the head of their global programs, was really an inspiring figure for me at the time. I think Paul's still with Movember Global, still working for the Movember campaign, but he was a very inspirational guy, and I really enjoyed working with him. So you're absolutely correct, Jordan. They have fun in their mission and vision statement, and they actually mean it. They really want to make sure that they're having a good time and being productive. And every person I met at Movember, they always had a story of a donor or a story of some client they were able to help, and they did a really good job of marketing their stories, and they had a really good web page that really made the campaign very efficient to raise a lot of money. So I still grow. I don't grow every year. I will admit, Jordan, I don't do it every year, but I do grow when I get a chance, and I do contribute always to the campaign.
Super fun. I imagine like a lot of what you actually did in that role and the disbursement of funds is probably very applicable to now having the team at Alberta Health or at Alberta Innovates in terms of like grant funding and dissemination of the money there.
Yeah, the focus was on value for money and impact, right? So that was the purpose of the reviews of Prostate Cancer Canada and Prostate Cancer Australia. So we were very much focused on achieving value for money and letting the organization know, the board know, that that's indeed what they were achieving. So that has stuck with me. Again, impact and evaluation are really key cornerstones of a funder's arsenal as you go forward in terms of investing in different activities. So you want to make sure you're always achieving value for money for the taxpayer dollars that we spend. So having that impact function is a very critical core competency for any fundraising organization.
When you're dealing with, organizations of that magnitude and size and just that volume of fundraising, how do you actually choose what to do with it after? I don't know if you have any insights in terms of the Movember Foundation, but what did they actually send the money out for?
Well, they traditionally had done, they sent the money to others to invest on their behalf. So all we were checking, all Dr. Nelson, Dr. Sewell, and myself were checking were the rigor within which they were overseeing and governing their systems of giving dollars out, how they were taking advice from the research community about where to invest the dollars, and then also ensuring there were no conflicts of interest or anything untoward that was happening with the money. And then the last piece was just making sure that they had a good, robust ability to assess the impact of their award and what it was actually achieving. So it's sort of the full life cycle of a funder investor sort of organization. So that's how you check, and you have all these mechanisms in place that you use to make that happen.
And then fast forward to today, how'd you actually land here in Alberta?
Yeah, well, my wife was recruited to be the chief operating officer of Covenant Healthcare back around 2012. When I had originally moved from the Princess Margaret Hospital to the BC Cancer Agency, where I spent 5 years in Vancouver, she left her job in Toronto for no job. And I said at the time, since I was a consultant when she got the job in Alberta, I said, next time maybe we'll leave for your job. So sure enough, next time came up, and I didn't, and all I needed was a laptop, an internet connection, a cell phone, and an airport. And Alberta ticks all those boxes for me. So I was able to come, very mobile at the time, and working with Movember Global. Again, they were in 21 countries, so it didn't matter where I was situated because there were always late evening calls, early morning calls. It was all different times. I never used my world clock so much from my Apple phone than I worked from Movember, because you were always checking what country they were in and what time it was in that country. But that's why I landed here. So I ended up coming as a consultant for Movember, still working for them, but living in Edmonton.
And then, so now you're running the health division at Alberta Innovates. What does that entail? Like, what do you actually do on a day-to-day basis?
On a day-to-day basis, well, I work with a great Alberta Innovates health team. I have about 22 full-time equivalents I work with here at the Alberta Innovates. I also have Alberta Innovates, as you know, is Alberta's research and innovation engine. We have about 600 full-time equivalents. We serve all economic sectors of the province. We have a pan-Alberta focus, and we're a Crown corporation. So what that means is I work on the executive team. I have responsibility for the health investment portfolio. We also have equivalent focused areas in entrepreneurial ecosystems, in artificial intelligence, machine learning, in clean tech, and also smart agriculture. And I have responsibility for the digital health portfolio. So what that means day to day, lots of meetings, lots of incoming on the inbox. But again, work with some really privileged to work with great colleagues in Alberta, great partners in Alberta, and also great partners across the country. So I get to work with national colleagues, and we've now reached out to work internationally with different groups. So I'm always working in that space.
And then in terms of just like the size and scope of things, how much money and grant funds are actually flowing through Alberta Innovates on a, annual basis, or how do you guys tend to look at it?
Yeah, we receive about $250 million a year from the provincial government. Our ministry, we report to the Ministry of Technology and Innovation. So Minister Nate Glubish is our minister. Again, but we serve the whole of government of Alberta in a way, because we work in multiple sectors. So Dr. John Zhao, my colleague in Clean Tech, works with the Energy Ministry. I work with the Health Ministry at Alberta Health. But I also, again, our home is in the Ministry of Technology and Innovation. So we have that. We have also been able to extend through additional funding from the federal government. So we've been able to leverage different programs. So, for example, we were able to bring in about, over the last 8 years, $36 million from the Canadian Institutes of Health Research for the Alberta Spore Support Unit, right? So that's the strategy for patient-oriented research. So that's, again, an extension of our dollars beyond the money we receive from the government of Alberta. And we have lots of examples of that. I think it's about a 60-40 split, I'll say, in terms of the additional dollars we've been able to leverage with the $250 million we take in.
And how big's the team? When you're dealing with that amount of money, how many people does it take to actually manage and vet all the companies and the projects that are ongoing?
We have 2 wholly owned subsidiaries, so they're in Alberta Innovates. So that's part of the 600 full-time equivalents, and they're the bulk of the full-time equivalents. On my team, I have 22 full-time equivalents to manage the budget we have. I have about a $48 million a year budget as part of the $250 we receive from government. So the other groups have similar sort of size FTE accomplishment in terms of what they do, but we not only provide money and funding, as I often say, we're more than our money. We provide services as well. So we provide a lot of enablement in our platforms to different communities. So I've already mentioned, Jordan, the strategy for patient-oriented research has embedded in it a data platform, which has provided over 2,000 requests for data services in Alberta Health Services, and be able to provide that to the researchers and innovators to help them get access to data, as an example. So there's lots of activity that we have that we achieve results through others. So we have our direct staff who work with our clients in small and medium-sized enterprises, innovators, entrepreneurs, and then we have our sort of platform programs that we run services through that enable those entrepreneurs and innovators to be successful.
And then I don't know if you can speak a little bit about to your own internal mandate. What are those KPIs that the Alberta government would be holding you and the team to? Is it jobs created? Is it import revenue? What are those main things that you guys are trying to achieve? Is it lives saved? How do you actually sort that out and make those decisions?
Yeah, we work through what I term 2 sides of the same coin. So we have an economic diversification mandate for our team. So that involves working with small and medium-sized enterprises, innovators and entrepreneurs to help them be successful, to grow their businesses, to create revenue, and to actually hire people to create jobs. That's one of the areas. We have tech scorecard as one of our key measuring sticks to evaluate that side of the business. We're a bit further. My team is a bit further upstream, so we're sort of the pre-angel, pre-venture capital side of the discover, develop, and use continuum in that regard. But then also we have we're trying to improve, generate patient-centered health outcomes that can benefit society and benefit patients. So we're always trying to achieve improved patient outcomes, improved health system performance. We want to have patients that experience the technologies in a positive way, and we also want to be sure we're not providers are able to use the technology where it's not a burden to them. So we're always looking for provider satisfaction as well. And we want to do all those 4 things with an equity lens to ensure that we're bringing along vulnerable populations and no one's left behind. So we have that dual sort of focus on my team around economic development and diversification, as well as health system performance, health system outcomes. So we're always tracking those types of metrics. The health system performance health outcome ones are a bit distal in the sense that they come downstream. Again, we're sort of upstream in the discover, develop, and use trajectory. So we're always trying to ensure that we have line of sight to those downstream outcome metrics. And so, but the function itself, Jordan, of tracking impact is one of the core competencies of Alberta Innovates. We have great strength in that area. We run the International School of Impact Assessment. We teach the courses at that school. Catherine Graham is a world expert in this space, and she's been able to disseminate her passion for impact across the entire continuum. So we work in that space.
And then how do you choose, which areas of focus? I mean, there's like a whole ton of different grants online at any given time, all with different mandates. Like when it comes to making a decision on those like patient outcomes, who actually makes those calls? Is that internal at Alberta Innovates? Does that come from the government of like, okay, wait times is a big problem versus cancer diagnostics versus cancer treatments versus any other number of things?
Yeah, we're always working with our clients to assess their needs, and our clients are in the health system. We have, for example, Jordan, we partner with Alberta Health Services on the Partnership for Research, Innovation and Health Systems program, PRIUS. We funded about 52 projects in that space to the tune of about $49 million over the last 8 years. So and in that sense, we work through the projects with PRIUS are derived from the clients, and the clients in the case of PRIUS are the strategic clinical networks who actually are at the coalface, and they're large networks of people who work in a particular area, like cancer, like the emergency room, like diabetes, the Dawn network. So there's various SCNs who derive the needs. They establish the protocols. They send the proposals in to us. We look at the proposals. We go through a 3-step process of assessing. We use external peer review, Jordan. So we tend to all of our grants get externally reviewed or reviewed by independent individuals. So we always have sort of a third-party opinion on whether the value, whether indeed what's being promised can be achieved. And we're always assessing the proposed value against that projection and using international experts to help support it. So it's a robust system of checks and balances as we go forward. As I often say, Jordan, one of my sayings is that peer review is the worst way to make decisions, except for all the other ways to make funding investment decisions. So it's not perfect, peer review. We do work hard in that space to make it as best it can be. I would just also, not all of our programs go through peer review. Some of them they all go through review. And so we have internal experts that work at proposals as well to ensure there's value for money. So, and then it all goes through a different set of decision-making mechanisms around funding to ensure there's a separation of the scientific rigor of the proposal versus the funding availability we have within Alberta Innovates. And all those checks and balances get audited by the Auditor General of Alberta. So we've had clean audits ever since I've been with the organization, and we also have had clean financial audits as well. So it's all very above board in terms of achieving that value.
When it comes to giving out a grant, how many eyeballs actually hit the paper in terms of reviewing them? I'm assuming it depends on the size of the project and whether it's like 10 grand versus several $1,000,000. What does that review process actually look like?
Yeah, there's actually, I hadn't thought, great question. I don't know how many eyeballs, and it's not paper now. We do everything pretty well digitally. So we look at, it's all on the screen. So you do most of the reviews online. There's obviously, every grant would have at least 2 reviewers of it. Some of those reviewers are external. Sometimes we have more. It depends on what's being requested in terms of the areas of expertise. And then there's the entire machinery inside Alberta Innovates. The grants administration team works with that. Finance works with the financial aspects. The marketing communications team work on the announceable activities in this space. So a lot of eyeballs go on I don't know how many eyeballs that is, but there's a lot of people involved in that value chain to ensure that the applicants are getting the 4-season service in terms of a good review. Not everyone, again, we turn down more applications than we fund. That's been the case. I've been in the business now for 21 years of giving out grants, and there's always more demand and need than there is funding available. So you always have to make forced decisions in that space. But I think we do a really good job of that here. So.
Does it ever culminate in internal conflict over who to actually choose for the grants, or is there ever times where it's like unclear on who the best project actually belongs to?
No, that's why we use committees. We use people that are external to assess, right? So we There are times when there's some passion, I guess I'll say, in terms of different funding opportunities, but we try to minimize that through process. So a strong process can help mitigate a lot of those concerns. We want to make sure there's no bias in what people are funding, right? So we're always trying to do that, and we do. I think that we do a very good job of that here. So I'm very proud of the way we deal with conflicts, myself included. I have to sign a declaration every year that I'm not conflicted with any of the applicants who are applying. We have to go through checks and balances within our own corporate structure. As a VP, we do reporting to the government in that respect, in terms of, I think, the board, to the CEO, to the executives, right down to the staff. We have to review our policies every year. We have a check and balance in that regard. So there's lots of checks and balances in ensuring that nothing untoward is happening. No biases are creeping into our decision making, and our decision making is above board. That all said, Jordan, I've been in this business for a long time, for 22 years or 21 years. Those that are successful think our process is the best process ever derived. Those that are unsuccessful think it wasn't the greatest process ever derived. That is a truism that always happens. So we're always in the space of telling people they were unsuccessful for their applications, and we try to do that as nice as possible. We also do it in a way that gives positive feedback to the applicants who were unsuccessful, so that they can improve their application and come into the next time. And the other thing I think that's maybe not a new thing, but one that I'm very proud of in Alberta Innovates is there is no wrong door here. So sometimes if you're unsuccessful over a particular competition, we can move you up and down the value chain from discover, develop, and use of your innovation to the right place. So there is no wrong door. We can get you to the right place for the right resource at the right time, so that you can either succeed quicker or you can fail faster. So we can then move on and use the taxpayer dollars for better value for money.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. Very cool. No, I actually recently had the honor of participating in the Canadian Medical Association and their $10 million Healthcare Unburdened grant program as part of the review panel. So I have a newfound appreciation for the process and the amount of work that actually goes into reviewing just huge volumes of grants coming in. It's so difficult too, especially when there's so many different high quality and just of completely different scope and nature projects that you're trying to sift through.
Yeah, there's always great quality and there's always high quality, especially in Alberta. There's a lot of innovative energy, and there's been a lot of a surge in terms of that innovative capacity in Alberta. So, we also provide a concierge service too. So again, there's no wrong door at Alberta Innovates, but we can also get you to other funding opportunities federally. So there's lots of programs we're aware of that may meet the innovators' needs or meet the small and medium-sized enterprises' needs. So again, we're here to, with our funding programs to decide, but we'll also refer people on to other agencies if they're better, or other partners in the ecosystem who can help you, right? So we're always trying to make sure we create that rising tide in Alberta of research and innovation.
Yeah, exactly. It's sort of the relationships and the networking that form along the way. Because I know Alberta Innovates has definitely been helpful for us at Cherry Health, and shout out to Mike, our TDA. He's been fantastic so far.
Yes. Oh, Mike's great. Yeah, Mike's a great guy. Yeah. And the TDAs are great too. We have about 22 technology development advisors in our organization. So that's a great example, Jordan, of the regional innovation networks, funneling innovators and entrepreneurs towards value. They send clients to us. We send clients to them. It depends what stage people are at on their innovation journey. But again, we cover the entire waterfront of discover, develop, and use of that innovation and technology. So that's why we are Alberta's research and innovation engine. That's why we have that ability to go end to end and get you in the right place at the right time for the right reasons.
Tell me a bit about some of the successes you guys have had. What's like the biggest project or the coolest project or the largest impact? Are there any like star children you can point to that just knocked it out of the park or were really noteworthy?
Yeah, it's hard to pick one. Like this is my success, but I'll give you a category probably, and I'll give you maybe a couple examples in that category. I'm a big fan of moving innovation upstream. So anything that involves early detection, anything that involves labor enhancing or labor conserving technologies that make the healthcare providers life easier, and also being able to see more patients as a result of that technology is a winner for me. Like that's something, and also that helps support patient-centered care that meets the needs of the patient. So those that live in rural, remote parts of the province can equally access in the health system we so desire. So that's the category that I'm very I like a great deal. I guess in that category, I would say that Nanostics, for example, with Clarity DX, we were a longtime supporter of Nanostics, the company, and they created Clarity DX, which allowed for a simple blood test to get an accurate diagnosis of a prostate cancer, which helps with early detection of prostate cancer, because the sooner you detect cancer, the better your probability of a good outcome in that space. But it also involves a lot of reduction in biopsies, saving the health system money, right, in terms of that activity. So we were able to help them since 2013. We're not the only ones, but both our entrepreneurial ecosystem team and our health team work with Nanostics and Dr. John Lewis, in helping him develop that Clarity DX test. And that's now been accepted in Alberta. Last year we were at BioAlberta's 25th anniversary, and they announced the successful adding that to the formulary for Alberta to offer it to citizens. So it's a great example of a great test. I would say the other one would be WaveView Imaging. They just won the Pfizer Innovation Award. A really cool technology around a safe, portable, pain-free breast imaging using low power microwaves. And the cool thing about WaveView Imaging again is early detection in cancer, the ability to do so in rural, remote areas, so you don't have to have a big diagnostic machine. And probably the last one, Jordan, I'll just mention this because it was at the announcement yesterday from our Accelerate Innovations into Care Concepts program. But Dr. Hadranathan from the University of Alberta developed a ultrasound you can do on your iPhone, right? So it allows, but it uses artificial intelligence to do remote imaging of your arm, for example. Say you're at a ski resort, you fall in your arm, you want to know if it's broken. This can literally be done remotely to tell you whether you need to go to the ER to have you did break your arm or you didn't break your arm, or you might want to have it further investigated. So the example they used in the demo yesterday was if you're in the ER and you don't want to wait 6 hours to get your arm looked at, they could possibly do this quickly and then decide, well, you didn't break your arm, you just sprained it. You can probably go away and come back, see your GP in the next few days. You're going to be fine. And they use artificial intelligence to help with the ultrasound to make that diagnosis. So I thought that was just really cool. And all that cool tech that really enables, again, both the patient orientation is really cool because it thinks about the pain points in our healthcare system today, whether it be the emergency room or whether it be the long waits or whether it be just in Clarity DX, the unknown, right? The stress of not knowing whether you have prostate cancer. So those are great innovations, I think, that show that upstream early detection, early recognition, being able to help avoid, make the health system work smoother and also help patients get a better outcome.
Yeah, no, that's incredible. Especially like you mentioned, the upstream value, right? An ounce of prevention's worth a pound of cure when it comes to dealing with healthcare, and especially those early diagnoses, right? That can make all the difference in the outcomes. That's amazing. What about AI? You mentioned a little bit about that. Is that becoming a trend in the industry? Is just AI popping off in terms of the actual innovations coming to light and applying for funding?
Yeah, I'm absolutely convinced, Jordan, that advanced data analytics and artificial intelligence, machine learning are going to transform healthcare, right? So many of our proposals are incorporating, like I just mentioned, Dr. Harun Anathi's portable AI ultrasound imaging technique, right? So that was using artificial intelligence in that space. We have an artificial intelligence enabling better health call in the field right now. We've had over 64 applications come into that particular call. We'll soon be announcing the successful applicants in that space. But it just shows the importance of artificial intelligence and reinforcement learning, of which Alberta is a world leader. We're top 3 in the world for reinforcement learning over at the Alberta Machine Intelligence Institute, and that application to healthcare is going to be a game changer. We know that then the algorithms are only as good as the data that's fed to the algorithms. So we know that artificial intelligence needs vast quantities of high quality data to ensure a good prediction, good outcome. So we're working with government, working with different providers to help enable that access and data scientists. So I think it's a huge area. It's just only going to grow. The market cap, it depends, compound annual growth rate. I've seen it as high as, $27 trillion coming forward in the next few years, right? So we've got a huge market opportunity. We have a comparative advantage compared to other jurisdictions in Canada and in the world. And so we have to leverage, I think, that advantage here in Alberta.
Is there anything specific that you're really looking forward to the most in terms of healthcare or in terms of the innovation space? Any particular domains you think are really going to be popping off or making an impact over the coming decades?
Well, we just mentioned a really important one, artificial intelligence and machine learning applied to the problems in healthcare. I think that's absolutely key. One of the things that I'm seeing, Jordan, we're seeing over and over again is the health human resource crisis that Canada's in. So we have the World Health Organization predicts that the world will be 18 million health practitioners short by 2030. So that's in 6 short years, we'll be 18 million health practitioners short. So what we're looking to emphasize then in the context of that is innovations, as I said before, Jordan, that enhance the productivity of the labor of physicians and nurse practitioners and nurses to be able to do more with the same or do more with less, so they can see more patients in their days in the activity. Or we want technologies that conserve their time so they can spend more time interfacing with the patients to help support them in their care journey. So we really want to prioritize that across the domains of primary care, acute care, continuing care, and also mental health and addictions. So those are the 2 things I think are really starting to collide. One of the things that's clear is that even if we have access to data, sometimes we don't have we don't have the skill sets to use the data. So we have to work on developing analytic skills within our professions, within our domains. I know a lot of people were trained to be physicians or nurses or dietitians or occupational therapists, but they weren't trained to be data scientists and data analysts. So we have to work as a team and an interdisciplinary team to move that forward into the next phase.
And how can we foster more of that innovation from the inside of healthcare, getting more doctors, dentists, nurses, dietitians involved in that systems change and involved in that bringing things to the next generation?
Yeah, I think it comes, to me, it comes, I go back to maybe my Princess Margaret Hospital days back in 1992 to 1997, where, as I said before, Jordan, that innovation research culture sort of greets you at the door and draws you in, right? It makes you part of you have to have that curiosity and experience. I think for innovators that are professionals out there, I'd say there's really no harm in 2 things. Number one, giving the Alberta Innovates staff a call. Call me, call my team, reach out to members of my team, have a conversation, because I think a lot of innovation starts with the needs of the healthcare providers, but it also starts with a conversation with where we might be able to provide some funding, some support, some referral on to another group, to another partner, what have you. And the second thing, Jordan, I'd say is what we're trying to do, what we have been doing, and what we've been done quite successfully is we have a signature conference in Alberta. It's going to be May 29th, 30th, and 31st in Calgary, which is called Inventures. And the whole goal of Inventures is to have creative collisions amongst professionals. So it's basically the physician talking to the artificial intelligence expert researcher, talking to the postdoctoral fellow, maybe talking to the dietitian, and then striking a sort of a project or an idea. And those creative collisions are really important. We'd like to foster them, not just there, but a year round, but that is our one sort of touchstone event. Last year, we had 3,500 people attend Inventures, and this year we're anticipating about 4,500 people attending Inventures. So I would say those are two vehicles, Jordan, that I think, plus all the other events that we have throughout the year, to get involved. And I think, to me, it's like leadership. You've got to put your hand up. You got to have a conversation to get going. I think that's one way, Jordan, to get into the innovation space and create that curiosity, which I think leads to a learning health system where we can actually get to a tipping point where we can make a change in our health system for the better.
I love that. Just creating those connections and then networking. Because I get like fairly regular messages from doctors that are interested in technology, interested in innovation. Some of them have an idea of what they want to do. Maybe they've got their own project they want to launch, but there's many that just are like, I'm kind of techie. Like, do you know who to point me to or where I can go to start connecting and, see what's actually out there? So Inventures is probably a fantastic spot for that. Checking out all the different vendors, the different speakers, and just seeing if there's anything that resonates.
Yeah. I mean, the one thing I'd say is that it's the one learning I have in this role in relationship to my team as we learn, it's more than the technology. So there's more than just the tech. A lot of people have good ideas and good tech, but it's how it meets the needs of the system and how it fits in. So what I see a lot of is a lot of what I would call technology point solutions that may work at one point in the client patient journey, but really do not work upstream or downstream or disrupt the workflows of the healthcare team as they assess that patient. So not that in and of itself that's a bad thing, but you have to understand that it's changing the models of care, changing the mindsets, and then bringing in the skill sets to use the technology. And then the technology itself is in the tool set category. So it's that expression, Jordan, from Stephen Covey, mindsets, skill sets, tool sets, in that order. And we have to start thinking about that around health system transformation as we move forward.
If you were to go back and do it all again, is there a particular project you would work on? Something in the cancer domain or otherwise?
What I work on? No, I'm very happy. I mean, I was able to, one of the projects from the Princess Margaret Hospital was the re-engineering of radiation therapy. And that we had all the tech at the time. That wasn't the challenge, but what we had were professional groups that didn't work well together as well as they could have optimally, right? So the radiation therapist, the clinical physicist, and the radiation oncologist. And then I also was able to bring in advanced practice nursing into that realm, and that was that improved the quality of care. So that's one I always look back on that I think we achieved the cost savings of the project. So we were able to save $1 million a year. We were able to increase the throughput by 20% on the learning accelerators. But most importantly to me, not that those things are unimportant, but we were able to bring in advanced practice nursing to the radiation oncology radiation patients, and that was able to increase the quality of their care experience. So that was the quintuple aim, I think, from my point of view, in being able to do that. So I wouldn't go back and do that one over again. I'd like to see that continue on, that mindset shift as we go forward in healthcare, because we still have large problems in the healthcare system. But I think collectively we have to get out of this problem. And my other thesis, Jordan, is that I'm pretty sure we can't spend our way out of this problem. We can't hire our way out of this problem, because again, those numbers from the World Health Organization would indicate there's going to be some headwinds to hiring. But the thesis is we have to innovate our way out of these challenges, right? So we have to find innovative ways to work with models of care. And then we have to have tech support the new models of care for better health outcomes.
Yeah, I wish it was just single variant, something that we could use or spend or do differently to like really improve the healthcare system for everybody. But it's unfortunately frustrating that it's just so multifactorial and everything has to come together sort of in that beautiful symphony and work together. I guess before we wrap up then, do you have a health tip? What is your number one thing for people out there listening in terms of how do you keep your head on straight? How do you manage stress? How do you keep your body moving? What's the secret?
What I do, I don't know if it's for everyone, but I do play ice hockey with two teams in Edmonton. So I play with a pickup group on Monday evening at the the CAC rink in northern Edmonton, and then I play with the Tornadoes, another group. We play league. We play around the city, so I do that. That helps with work-life balance. It helps with exercise. I think the second thing I've done in the last 8 years that's helped my work-life balance and stress is I've joined a book club. So I've been able to read about 7 or 8 books that I probably wouldn't have read otherwise. And so it's a good group of guys. And so I'm just starting to get into that space as well, which is interesting because it helps apply. You read a lot of books that help you can apply in your work life too. So you take a lot from those things. Plus it's good conversations and good fun with the guys. So I enjoy that. So those are 2 things, Jordan, I do. I don't know. Everyone's different. So everyone has to find their own way they deal with stress, especially in this environment, right? There's a lot of things changing, and change brings stress. So we have to find ways, I think, to manage ourselves, because this is going to be a long-term exercise of system transformation. It's not going to be a quick linear path to the solution, but it does take a collective effort by everybody to get on the same page. And I think that's one thing. If I could wave a magic wand for healthcare, if we can get everyone on the same page, I like our chances better for change than if we work in silos or we work individually.
A very Canadian answer, the therapeutic benefits of hockey. And I do hope that we're able over the next coming years to get everyone on that same page and working together towards those shared common goals. Any last things before we wrap up? Anything else you wanted to throw out there?
No, I think we have to shift also in Alberta from a regional mindset to a global mindset. So I would say that I'm really excited. The next week, I'm going to be able to go to South by Southwest. We're taking 50 companies from our accelerator program down, and my colleague Doug Holt, who's the AVP of entrepreneurial ecosystems and investments. We're taking 50 companies down. Last year they did it. I wasn't part of the delegation, but we were able to achieve a 9x return of capital to those companies that went last year. So this year we're setting the bar a little higher. We're going to look for a 10x plus return of capital to those companies that go in terms of deal flow. And we're working really hard to make sure that they're successful. About 20% of the companies of the 50 are in the health, life sciences, digital health space. So I'm going to help sell Alberta to the investors and to the VCs in Austin, Texas. South by Southwest is one of the largest technology conferences in the world. So we're going to have a really good chance to work there. And the second thing I'd say, Jordan, is we've also formed a partnership with the Nordic Health Lab in Denmark, right? So we're able to work with them, and that's been a really beneficial relationship because I see a lot of the cross-pollination of ideas of what works in Denmark that are a bit further ahead than us in their transformational journey. So they're helping work with us on some of the things that they see. They also see value in things like artificial intelligence and machine learning here that they don't have quite the strength than they have in Denmark. So that cross-pollination of ideas, I guess that regional mindset to a global mindset is really helpful because it shows us that it is possible, that transformation can happen, and we can achieve greater value for the health system, for the health of Albertans.
Awesome. Yeah, well, hopefully the new partnerships are yielding fruit. It's great to see you guys expanding out and reaching out to those international organizations. And, honestly, on behalf of all the healthcare providers out there, thank you for everything that you and your team are doing for us. We appreciate it.
Well, very good, Jordan. Thank you very much for the opportunity. I really appreciate you giving me this opportunity to speak to you.
Yeah, thank you. And best of luck at the conference upcoming.
Very good. I'll let you know how it goes. Thank you.